Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Abnormal hemoglobins, and we're looking at the clinical effects. So first is we look at the population. So under the population, what is it? So under population of the African. So we look at under the African population designated by the sickle S. Sickle or the S. So sickle or the S, the main clinical effects here, it includes the anemia. So it involves the anemia as well as the ischemic infarcts. So this was about the sickle S, and then we look at the C, designated as C. This is in population of African, and the main clinical effects, it includes a mild anemia. So there is mild anemia as well as there's interaction with the HbS, Next is we move on to the E, the variety designation E. The variety designation E is it includes the Southeast Asian. The Southeast Asian, and the main clinical effects being there is microcytic anemia. So we are writing it as MA. Then the splenomegaly. So let's write it as micro. So microcytic anemia. Then comes the splenomegaly. Then comes the splenomegaly. So microcytic anemia, then the splenomegaly. All this is Southeast Asian. Splenomegaly. Then comes the thalassemia phenotype. Phenotype. Next, we look at the colon, KOLN. So here in the KOLN, colon, the population here it is nothing but the sporadic. Population here is sporadic. And what will be the main clinical effects here? So here the main clinical effects will include the hemolytic anemia. We are writing it as HA, and then the Haynes bodies. So Haynes bodies are present, and this is the splenectomized. When splenectomized. This is when splenectomized. So then we look at the Yakima. So what is about Yakima? Yakima means it is sporadic, and this involves a polycythemia. Next is the Kansas. So in terms of the Kansas, the population, it involves a sporadic. It is a sporadic, and the main clinical effects being the polycythemia. The main clinical effect is a mild anemia. So Kansas has mild anemia. Then we look at the M Iwata. So under the M Iwata, this is again the population being the sporadic. So the population is sporadic, and what is the main clinical effects? Main clinical effects includes the hemoglobinemia. So it is a hemoglobinemia. To learn and grow daily like this, please do subscribe.